This is a public service announcement for the states of Maine, Connecticut, Massachusetts, New Hampshire, Rhode Island, Vermont, New Jersey, New York, Pennsylvania, Ohio, Michigan, Indiana, Illinois, Wisconsin, Minnesota, Iowa, Missouri, Nebraska, Kansas, North Dakota, and South Dakota. I come to you tonight as the director of FEMA. We have been informed by the CDC that a recent batch of influenza vaccinations released for use on October 1st to 21 states is responsible for the mysterious illness occurring throughout the Northeast and Midwest. The synthetic influenza vaccine appears to have properties that cause mutation of the virus when introduced to human T cells. The results of this mutation are causing serious illness, paralysis, and in some cases, death in people who have received the vaccine. FEMA is working to inform the public by working with local health departments, local state emergency responders, hospitals, the Red Cross, as well as government officials. Half of the doses of the vaccine released have been found to mutate once the vaccine comes into contact with the body's T cells, which leads to infection, usually within 30 days of receiving the vaccination. Symptoms of infection include fever, vomiting, diarrhea, and headache can also be experienced. Within 3 to 5 days of the initial onset of symptoms, the mutated vaccine can start to attack the nervous system, causing paralysis and in some cases death. Those at greatest risk are the very young, the very old, and the sick who have received this synthetic vaccination between the dates mentioned. The manufacturer has assured FEMA and the CDC, as well as government officials, that only half of the vaccines were actually contaminated. What we know now is the vaccine was distributed to 21 states within the Northeast and Midwest. Initially, the illness was found in 9 states, including Maine, New Hampshire, Ohio, Kansas, Minnesota, North Dakota, South Dakota, Indiana, and Iowa. As of December 15th, cases of infected persons who have been reported in 5 states, including Ohio, Maine, Minnesota, Iowa, and Indiana. The vaccines were available to public from October 1st through December 15th. If you live in one of the states mentioned and are concerned that you may have received a contaminated vaccination, you are encouraged to contact your physician. If you have had the influenza vaccine and are experiencing flu-like symptoms, including fever, vomiting, diarrhea, and headache, you are encouraged to go to the ER for further evaluation. As of today, 75% of the available vaccinations to the public have already been used. The remaining 25% is on its way to the CDC for further analysis. Persons at risk are those who live in the 21 states and those who have received the synthetic influenza vaccination between 10/1 and 12/15. It is imperative that we remain calm during this process of discovery. Our goal is to keep the public informed by updating local and state officials when information is available. We have not yet ruled out bioterrorism at this time. It is important not to jump to any conclusions this early in the discovery stage. FEMA has set up public information tents along with staff available to assist and obtain vital signs and assist with determining the risk of exposure for those who receive the vaccination. Until more information becomes available from the CDC, we ask that the public let us do what we need to find out how to treat and cure this mutated strain. This means seeking medical attention at the appropriate time. We do not want to overrun our hospitals and urgent cares. Again, you are only at risk if you received the synthetic influenza vaccination between 10/1 and 12/15 in the 21 states affected. Washing your hands frequently after using the restroom and before eating can stop the spread of infection. Also, keeping your hands away from your eyes, nose, and mouth will stop the spread of infection. Refrain from sharing items like food or drink with others. This will also keep you from getting infected. If you have concerns or questions or would like more information about the vaccine or any other issues, please go to our website at http://fema.government.vaccine2016. More information can also be found at the CDC website, cdc.government.vaccine2016. Thank you.